My name is Taylor and I'm a student nurse. I'm going to be putting in a Foley catheter into my patient today. I'm going to check the order to see what size we need, if she's had any previous catheterizations, if she has any diseases that might hinder or cause some problems with the catheterization. And I'm going to get all of my supplies ready. And I'll come into my patient, introduce myself, get her name and date of birth, and check to see if she has any allergies, which she says she's allergic to betadine, so we won't use betadine to clean. We will use the alcohol instead. I'm going to assess to see if she feel like she has any bladder fullness or any pain, how she feels about the procedure, help her with any apprehension she may have, and then we'll get going. So first I'm going to pull this down, and I will provide privacy pulling the curtain and closing the door. I'm going to go ahead and expose her, and I will perform pericare as needed, and that will give me a chance to assess her to find her urinary meatus. And then I will, after I'm done, put on new gloves and perform hand hygiene. Put down an absorbent pad, and this is not sterile, so this is just to provide extra area in case she urinates around the catheter while I'm inserting it. And then I'm going to get my catheter, and I'll open up my kit. I'm going to leave this at the end of the bag as a sort of trash can. And I'm going to put this in between her legs and carefully open this, only touching the 1-inch border. Since I'm not sterile yet, I'm going to remove my cup, my sterile gloves, and I'm going to remove this absorbent pad to put underneath my patient. I'm just going to drape it, and I'm going to come around my patient and pull it straight, only touching the 1-inch border to keep it sterile. I'm going to remove these gloves, perform hand hygiene, and then put on my sterile gloves. Going to make sure to put it on my dominant hand first. Now fix my fingers. Okay. And now that it's sterile, I'm going to make sure to keep my hands above my waist. And we're going to put out the rest of our sterile sheets and not touch my patient with my hands so I don't break sterility. And this is the thin-stranded pad, and that will just provide some privacy for my patient, and it's going to have the opening right over her urethra, so that way we can see everything we're going into and everything around it is sterile. So I'm going to get my hydrogen peroxide. I'm going to get rid of my betadine since she's allergic to it. I'm going to pour the hydrogen peroxide on my cotton balls.
I don't want to have to take it because we have to change planes in Chicago, and I don't want to have to take it from one plane to the next.
Throw that away.
I know, that's what
I'm going to put some lubricant out.
If I have to pay to check it, I'm just going to buy a car seat and have my dad ship it to my dad, and he can keep the car seat. But if I can take one came with our rental car, so that's fine.
Put the end of the catheter in the lubricant.
Well, but it was $90 for
And I'm going to go ahead and hook up my saline to inflate the balloon to my catheter.
and that sounds so bad, but who cares? Yeah.
Okay. First thing we're going to do is clean. So I'm going to take my dominant hand and spread the patient's labia. And now that I've touched that, that is not sterile. This hand is not sterile. So I'm going to clean the furthest side first. Closest side to me. And then down the middle.
Yeah, I don't know what my dad would do with a spare car seat, but.
Next, I'm going to insert my catheter, and I'm going to go in about 2 to 3 inches until I get urine return.
Everyone takes your picture, you can wear the same dress, like,
Right.
so I was gonna buy one and take it back, but I actually.
So I would have got urine return, and then I'm going to go in another inch to 2 inches.
It fits me better now, 'cause I'm getting
I'm going to hold
out a little bit.
the catheter,
I just saved like $50.
and I'm going to inflate the balloon.
Yes.
I'm gonna pass the right place, because I can't afford it, sorry. Just like.
Take the syringe off.
I know, well,
And I'm going to give it a little tug to make sure that it's in place, and it is.
like Vegas
Okay.
for the bachelorette party, and I'm like,
So next I would go ahead, secure my catheter to the patient's leg,
we all went back to my house after the
and hang the bag
and we sat around and
on the
talked
side
for
of
an
the
hour, and
bed,
I passed the
making sure not to put it on one of the arms of the bed. So I would hang that,
I was like,
and then that would have stayed because I would have had better tape. For a male, I would hold the penis erect to clean around it, and I would go around the urethral meatus, and I'd use 3 different cotton swabs going in a circular motion towards the shaft. And then when I would insert it, I would go at a 90-degree angle and probably about 5 to 7 inches, and then with urine, I would get urine and then go in another inch to 2. And then I would clean everything up, provide privacy for my patient, make sure I'm getting urine return. If I needed a urine sample, I could take it straight from the bag since this is the first time the bag has been used. Otherwise, I would have to take it from the port where I would clean and then take the urine from straight out of the port after clamping it for about 30 minutes. And that's it.